So making your butt larger has become a very popular procedure worldwide, and there are different ways that you can do that. Basically, in broad categories, these would break down into either using a synthetic implant or using your own fat to graft into the buttock region to create a larger, more shapely buttock, so-called Brazilian butt lift. Benefits of an implant are you don't have to operate on another part of the body. You're going to get a consistent volume augmentation, and you already know what the shape of that implant is. The downside to implants is there's a very high complication rate, and depending on the studies that you look at, wound infection, wound healing issues, implant malposition, capsular contracture around implants, and other issues can run anywhere from the 40 to 80% range. In addition, you're going to create larger scars in the buttock region, and I'm not a big fan of buttock implants because of that higher complication rate. Fat grafting, on the other hand, can give you an attractive shape. It's natural. The fat is your own. If it stays for 6 months, it'll stay long term. Main issues with fat grafting are that the survival of the fat that you put in there from liposuction and other part of the body is not 100%. So we tend to overcorrect a little bit, knowing that we're going to lose some volume. And you have to stay off your buttocks for a couple of weeks after surgery to avoid excess pressure, which can influence the survival of the graft. The final thing with fat grafting, which is a serious issue, is patient safety. Like all procedures that we do, we want to have a safe operation. When we do fat grafting in the buttocks, we're going to be staying in the subcutaneous space between the skin and the muscle. A number of patients have had adverse outcomes, and there have been a number of deaths from fat grafting into or beneath the gluteal muscles, because there's some large blood vessels down there that can get damaged, and fat can go into the bloodstream and cause pulmonary embolism. So if you're going to do fat grafting to the buttock, which can be done safely, it's important to stay on top of the muscle and use techniques which allow you to fill that space and expand that space without violating the muscle fascia. And that's how we like to do our procedures. Additionally, if you put a huge amount of fat in, you're more likely to have complications with fat grafting. So you want to put in a moderate amount of fat so that you can get the best shape and the best chance for survival long term with the fewest risks.